She had diabetes, and she had been diagnosed with bipolar disorder and with depression.
Her mom became alarmed at the amount of pills that her daughter was taking.
It's like giving them a gun and putting it straight to their head.
Smacks a little bit of somebody operating almost like a witch doctor.
Chelsea Dockery was a 21-year-old young woman who had diabetes, and as a result of that, she had frequent body pains.
Her body did not produce any insulin whatsoever. So, she struggled with that.
Her mom had had 4 back surgeries, all of which had been unsuccessful. And she had been seeing Dr. Nichols for 7 years. And so when Chelsea began experiencing some pains, her mom trusted Dr. Nichols and referred her daughter over to her.
In the United States, doctors of osteopathic medicine are a little bit different than they are around the world. I am Dr. Jason Beeman. I'm a forensic psychiatrist and addiction medicine doctor practicing in Oklahoma. They are fully licensed physicians that are very similar to MDs, just a little bit of different philosophy in the way they approach medicine. First is that the body has the ability to heal itself. That as an osteopathic physician, we want to minimize medical intervention and allow the body's natural healing processes to take place if we can. So historically, osteopathic physicians have been a little bit more skeptical on medications.
Dr. Regan Nichols spends 4 days a week working at the Sunshine Medical Clinic. She's the only physician there, and then she spends 1 day a week at another medical clinic. She's trained in general practice, and so she is basically treating a wide variety of illnesses that people would come to present to her. So it could range everything from a child who had chicken pox, for example, or some kind of cough or cold, a patient coming to her for high blood pressure. I'm Dr. Joni Johnston. I'm a clinical and forensic psychologist and private investigator. General practitioner, they're like a community doctor. And I think that because of that, the community starts trusting them, because they oftentimes treat the whole family. I think at this point, her career is really on track. I think she is developing a good reputation in her community. This is a town that she's living in of about 55,000 people. So she's kind of making a name for herself, and she's developing a regular client base. She's successful in the community.
At the same time as the Sunshine Medical Clinic is getting established, in the United States of America, we've got millions in the grip of an opioid addiction. I am Professor Donna Youngs. I am an investigative psychologist. We've got this crisis slowly devastating families as they powerlessly watch their loved ones slowly self-destruct. So this drugs crisis is really swallowing up, particularly the youth of America at this point in time.
One of the most horrific things about the opioid epidemic is that individuals were fine until they went to the doctor. They weren't addicted. They were living life fully, and then let's say they have a car accident. And it wasn't the car accident that killed them. It was the treatment for the car accident that killed them. There's something horribly wrong with the fact that in 2008, more people were dying of overdoses from prescriptions than from motor vehicle accidents or firearms. There's something horribly wrong with that. The health outcomes are worse when you go to the doctor. When all of your patients have cancer, that's not a good market for you. The pharmaceutical companies realized that their patients were dying too quickly and they weren't getting as much money as possible. They recognized that they had to move out of cancer and into other, quote, non-cancer chronic pain. In the 1990s, the pharmaceutical manufacturers launched an aggressive, unbranded marketing campaign across the United States, including Oklahoma, that had millions, if not billions of dollars going towards getting as many people prescribed this as possible. They were giving doctors trips and golf clubs and all of these gifts, and those gifts matter. And studies have shown that even a meal from a pharmaceutical company will increase your likelihood of prescribing that. When I was in training, I was still taught that you can't get addicted if you have pain. And that was the gimmick. That was the lie that the pharmaceutical companies peddled to all of the physicians in training, is that if you have pain, something magical happens to your brain and you can't get addicted. Just to put that in perspective, it's like saying if I stub my toe, I can't get addicted to heroin. And when you say it like that, that's kind of ridiculous, but that's exactly what they were saying, is that if you hurt your back, you can't get addicted to OxyContin. And we now know that that was a horrible lie that hurt and killed thousands of individuals. The most important piece of information needed to hold a rattlesnake is to know that it's a rattlesnake. If I throw you a snake but tell you it's a teddy bear, you're gonna get bit. And that's what these pharmaceutical companies did, is they said that these were teddy bears, but really they're rattlesnakes.
Chelsea had struggled with diabetes, struggled with controlled substances that were being prescribed to her, maybe not taking them specifically as required.
Dr. Nichols had also diagnosed her at some point with bipolar disorder and with depression.
Her mom became alarmed at the amount of pills that her daughter was taking and was worried that she was addicted.
Chelsea's mom had asked Dr. Nichols about the medication she was prescribing for Chelsea. And Dr. Nichols had responded, well, she's 21 years old. I can't talk to you about her medical care. She's an adult. And that's true. But Dr. Nichols was very comfortable talking to her at length about her daughter's diabetes, but then refused to talk to her about the medication prescription. And so that certainly suggests more that she's hiding the medication that she's prescribing for her daughter.
Chelsea Dockery's mum approached Regan Nichols in concern. Unfortunately, I think that this backfired. I think that Regan would have interpreted this as not as the concerned mother that it clearly was, but to be somebody questioning her judgment, criticizing her.
When Dr. Nichols visited her, she became aware of the fact that Chelsea had tested positive for amphetamines.
Dad should have told Dr. Nichols that her patient was getting drugs from someplace else, and that absolutely should have changed her treatment plan. But it doesn't appear that Dr. Nichols recognized the valuable intervention point.
Chelsea would have been much better off being transferred to a psychiatric facility where she could get some mental health care. Regan Nichols ends up just sending her home and telling her to keep her prescriptions up.
This young woman's only 21. She hasn't had a lifetime to build up a tolerance to these medications. With that kind of dose and volume, you're just asking for a bad outcome.
And within a week after her last prescription that she got from Dr. Nichols, she was dead of an overdose.
Addiction as a disease is a rare creature. Any other disease, your family rushes to your bedside and they're right there to support you, maybe even start up a fundraising campaign for you. But with addiction, it's not unheard of for people to die alone and isolated from all of their loved ones, having done damage to relationships in their life. It's a very horrible way to go. And it's even worse for the families who are left with the regret and the guilt, thinking of things that they could have done different, that maybe I didn't try hard enough, maybe if we'd have done this, but ultimately unsuccessful. And so the family is just left with that guilt that they should have done something different.
There's always going to be this sense of, I think, oftentimes of responsibility, of guilt. What could I have done? What didn't I see? What did I miss? And certainly, if it involves losing a child, which we know as psychologists is the absolute worst life stressor or life event that can happen to most people, is to lose a child. I think it's something that changes families irrevocably.
There's something just not quite appropriate about calling a medical clinic the Sunshine Medical Clinic. It's not consistent with the kind of restrained, risk-adverse, cautious approach that a professional medic should adopt. In fact, it almost has a slightly cultish ring to it. Although it seems like a wonderful, optimistic place that she's trying to create, I think there's some kind of very quiet warning bell going off here already.
This patient was concerned about her overprescribing prescription opiates.
The Oklahoma Bureau of Narcotics started investigating that, pulling patient charts.
What they discover is that Regan has been prescribing dangerous, controlled drugs, drugs that are particularly known to be abused on the street.
Dr. Nichols didn't limit herself to just the opioids as far as addictive medications go. There's other classes like benzodiazepines, commonly prescribed like Xanax or clonazepam. And then also muscle relaxers like Soma. And Dr. Nichols was prescribing large volumes in multiple different classes of addictive substances.
These things taken together were known on the street as the Trinity and were extremely sought after because it mimicked the injection of heroin. I'm Dane Towery. I'm a Deputy Attorney General for the Attorney General's office here in Oklahoma. So they started trying to identify if there was a legitimate medical purpose for all these prescriptions that were being prescribed. It was very, very scarce with information. She's not doing assessment. There was nothing documented. And in the medical world, if it's not in the chart, it doesn't exist.
Now, in medical terms, this is a completely unethical practice. It's a practice that speaks of a kind of pre-professional, pre-scientific approach to medicine. It's the kind of practice that smacks a little bit of somebody operating almost like a witch doctor. As somebody who can sense what the right thing is to do without actually formally diagnosing a patient.
In order to decide what that person needs, you have to meet them. You have to know their medical records. You have to do an evaluation on them. Without that information, you may be prescribing medication completely inappropriately for a patient. And the other thing it doesn't allow you to do is to evaluate their risk of addiction or the possibility that they already are addicted, or evaluate for psychological issues or psychological problems. There's no justifiable reason I can imagine for prescribing these kinds of medications to somebody that you haven't seen before. There was a lot of indication that she had diagnosed some of her patients with several different psychiatric disorders, depression or bipolar disorder, or panic attacks, and yet she's not referring them out for mental health care or psychiatric care. She's not referring them out for pain management. She's not doing detailed histories of her patients. She's not getting records from other treating physicians that they've seen in the past. It just more and more seems like this is somebody who treats many of her patients when they come in by writing a prescription based on what they want, as opposed to what they need, and her making that judgment as a physician. It's mind-boggling to think of one physician in a 4-year period writing 3 million prescriptions. And it's hard to explain it in any other way than almost like a drug dealer. You know, I mean, I would imagine that there are drug dealers who are giving less drugs in that period of time than she would.
And in fact, we know that the results of this are tragic. We know that 10 of her patients in the 4-year period following 2010 die from overdosing themselves on the drugs that she has prescribed.
10 individuals, had they not gone to Dr. Nichols, they'd still be alive. I like to remind everyone that there's no such thing as a spare Oklahoman. And those 10 individuals had mothers and fathers and husbands and wives, and were people who had their whole lives ahead of them and died because they went to the doctor.
She is called before the board and asked to explain why she wasn't referring them out, why she wasn't doing more comprehensive assessments of her patients. And she says, well, my patients just don't want to wait 6 months to go see a pain management specialist.
It's a shocking thing to say for a medic. It implies that she believes that her judgment can override standard medical practice.
She essentially says her patients came in looking for these medications, that some of them developed a tolerance for these medications and needed more and more for pain relief, which I think you step back and you kind of go, well, isn't that a sign of addiction? The fact that somebody's developing tolerance, but in her mind, it just means you up the dose. She told them that she knew that some of her patients had a positive drug screen for other substances, and yet she would sometimes, quote, fire her patients from her practice when they had a positive drug screen, but then she would give them a second chance or a third chance.
Dr. Nichols' policy of firing and unfiring patients is literally just quite bizarre. First of all, if a patient is addicted and they're showing signs of addiction that would lead a doctor to, quote, fire them, the doctor should not do that, right? Your patient's addicted, they have a disease, and you wouldn't fire someone for having diabetes, so you shouldn't fire someone for being addicted. What you should do is recognize that illness and either treat your patient's addiction or refer them to capable doctors that could treat the problem that you caused. But instead, Dr. Nichols would, quote, fire them, turning these patients out on the street, desperate, going through withdrawals. Opioids can be one of the hardest things to stop using. The withdrawal period, which can happen as soon as like 8 to 12 hours after your last dose, can be absolutely miserable. The worst physical symptoms you've ever had in your life: muscle cramping, intense abdominal cramping, fever and chills and sweats. flu-like symptoms. Absolutely miserable. And unfortunately, that's one of the reasons why individuals keep going back to it, is that they don't want to use. They recognize the addiction, they recognize the harm that it's causing in their life. They just can't get through the withdrawal period.
Regan Nichols grew up in the Midwest of the United States of America, moving to Kansas when she was 2 years old. She had a big family, 3 siblings, lots of cousins around, spent the summers in ranches with the cousins, lots of outdoor activities. My sense is of a vast, open childhood of freedom. It's a very wholesome upbringing. It's one without any sense of strife or struggle. And it's one where there seems to be a boundless sense of opportunities, very few boundaries, interestingly. Very little sense of her being in any way restricted or reined in as a child and as an adult. Everything seems to come easy, like the vast landscape, the great plains that she grew up in. Everything seems to be open and possible and without limitation.
Regan was thriving in this kind of small town community. She was kind of known as really an amazing dog trainer. As a matter of fact, some of her friends said that when she called her dog, not only would her dog come, but other people's dogs would come as well. She liked baking for these kind of local fair competitions. She liked the outdoors, she liked camping, but she also liked going to museums. So she really was somebody who was well-rounded and had plenty of friends. Regan attended osteopathic medicine school in Des Moines. And her school was actually known as a pretty prestigious osteopathic medicine school. In 2023, it had the highest number of passes on the boards.
And then in fact they go out to Mongolia to do medical education, helping the community there. It's again a very wholesome, healthy existence that she's living.
There had been a revolution, and Mongolia was really trying to transition between a communist-based healthcare system to more of a capitalistic healthcare system. And so there's a lot of need to get up to speed on more Western practices. And so Regan and her husband actually spent 4 years there. So this was not a luxurious assignment, and was really, in many respects, kind of an altruistic mission.
This move to Mongolia, I think, just may have cemented the sense of being part of a different elite world, being somehow the them as opposed to the us. I think it just may have instilled in her too big a sense of her own judgment, power. It's almost as if she may have started to, somewhere in the back of her mind, see herself as some kind of savior. It just reinforced her sense of her world as opposed to the world of those that she helped.
The volumes are just absolutely unfathomable. 1 month, she prescribed thousands of addictive pills. I don't know any doctors that actually can prescribe thousands of pills of all substances. But for this one doctor to prescribe thousands of addictive pills of opioids and benzos and muscle relaxers is just unfathomable.
Not only were these individuals visiting 25 different cities to get their prescriptions filled, they were accessing 107 different pharmacies. which again I think just illustrates that something is not right here, and it also illustrates the scope of the number of prescriptions that she is prescribing to her patients. That is extremely unusual in a town of that size, to have a general practitioner who's got patients that are basically fanning out to different cities to get their prescriptions filled. And it makes me wonder where she's getting these patients. And if they're not local patients, again, how are they hearing of her?
Doctors, lawyers, clergy, ministers, really no class has been left untouched. We do know that the hardest hit was our blue-collar working class individuals. These are the people that get hurt at work and they can't take a day off to let their body heal. And if you tell them, well, I've got a pill that will help you get through the pain, they're gonna take it, they're gonna work through that pain, they're gonna mask it with the opioid, they're gonna get addicted. Mother Teresa taking these pills long enough would get addicted. It has nothing to do with the moral character or the will of the individual. It's just science. Anyone taking these pills long enough will get addicted.
They released their findings as well, and they were pretty dramatic. And they basically said they took a 3-month period of time in 2014, and they found that she had prescribed in that period of time over 1,400 prescriptions for controlled substances. And given that her practice was supposed to be a general practice, that is incredibly excessive.
If you start to see one prescriber prescribing large amounts of those three, an opioid, a benzo, and a muscle relaxer, you're probably looking at a pill mill.
Dr. Nichols was arrested for essentially prescribing these controlled substances knowingly and without any medical necessity.
The arrest warrant for Dr. Nichols said that she prescribed more than 1,800 opioid pills to 5 individuals in the month that they died. So that's 360 pills per patient, assuming that they were getting equal amounts. Some might have gotten more, some might have gotten less. But 360 opioid pills per month comes down to, if you think that a month has 30 days, that is 12 pills per day that these individuals are taking. That's an incredibly high amount. When you stop practicing medicine and you just start prescribing controlled substances without any kind of medical judgment, you're a drug dealer. And there's no difference between you and somebody who's selling these same pills out on the street for a few dollars. You're trying to legitimize yourself as a physician, but really you're just a drug dealer.
We prosecute crimes with the hopes that people will understand, you're not going to get away with it. You don't commit crimes. And so we looked at this case. We believed crimes were committed. We believed we could prove it. And we put it to the jury. An opportunity we could charge it as murder in the first degree, because distribution of a controlled dangerous substance is one of those predicate crimes that would qualify for murder in the first degree. And so that carries life or life without parole, which is a very strong punishment, as well it should be. And I think we had a bit of an issue with forcing a jury to make that decision, because it wasn't your traditional shooting, stabbing, malice, aforethought type of crime. And so we looked at murder in the second degree. We thought that would be a better fit. It gives the jury a lot more wiggle room. 10 other deaths in addition to the 5 that we charged. I mean, 15 patients, that's a lot. We had videos of patients that were just like zombies, passed out in their food or falling asleep. That's not a way to live. It's not functioning. And of course, their patient charts weren't documented as they should be.
They basically said, this is somebody who didn't care about her patients. She knowingly prescribed these medications, that she was essentially operating a pill mill, that she was negligent in her practices, and that she was responsible for turning many of her patients into addicts.
I tried to explain just how egregious, absolutely egregious, the acts of Regan Nichols were. I think one patient had over 1,000 pills prescribed to him over the course of a month. That's absolutely ridiculous. I have been a prosecutor for a while now, and unfortunately, I've seen addiction through the lens of deprived actions involving, young children and their parents who are addicted. I've seen parents do awful things in order to get their next high. So I've seen what the beast sort of does to a person, and their will is overborne, right, with the addiction. And for some of these individuals that were taking opiates at a very, very high level, significant doses and amounts, it's like giving them a gun and putting it straight to their head. And yeah, they're the ones that pull the trigger, but at that point, they're not acting in their right mind. It's almost as if, we are protecting those who can't protect themselves at that point, just like we protect children who cannot protect themselves.
The defense argued that these people had not been forced to take the medications that she'd prescribed to them. I think this fails to understand both the raw vulnerability, physical and psychological, of these people going to the person that they trusted, the medical practitioner, the GP within their community. And it also fails to recognise the way that Regan would have been viewed in this small town community as the physician at the central medical clinic, a person of respect, a person who was there to help them.
They really focused on the fact that she had no intent to kill anyone, this was not her fault, and that she actually cared too much about her patients and didn't want to deprive them of what they needed to, go forth and go on each day.
I think certainly when it came to patient deaths, that she was likely to view this as, the problem isn't that I'm prescribing these medications. The problem is the patients are taking too many of them. So I think in her mind, she probably thought, well, this isn't my fault. This isn't my responsibility. I'm giving them medications. I'm giving them, muscle relaxants, anti-anxiety medications, opioid medications. They're asking for them. They're saying they need them. And if they take too many, that's kind of really not my problem. Maybe it was a slippery slope for her. But I do think over the years, she became more and more willing to prescribe medications to anybody and everybody. And perhaps she didn't think about the consequences. Perhaps she blamed the consequences on people who were abusing her prescription doses. But at some point, she knew patients were dying under her care.
She came across a little detached from the moment, from what was going on, just what was playing out in front of her. There wasn't very much emotion there. There was nothing, it was just blank, just kind of void. These are her patients. I kind of expected a little bit more. These are people she saw every month, over and over. And to think that somebody across the room is saying that I'm responsible for the deaths of all these people, my patients, while her attorneys are at the same time making the defense that she cared about her patients. I just didn't see the emotion that I thought I would see. I remember there being some not guilties first, and your heart kind of sinks a little bit. You immediately start thinking, what's the difference between count 1, count 2, and count 4, and count, how could they reach that conclusion and still allow me to have hope for a conviction on the other counts, right? And then they read the Chelsea Dockery count.
The jury ultimately found Dr. Nichols guilty of one charge of second-degree murder.
Chelsea is in her 20s. The other 4 charged individuals were a lot further along in life. And I think the jury felt more for Chelsea Dockery because of that. And since she was young, she got a full autopsy. And I think that also played a big part in the conviction of that particular count. The others didn't have a full autopsy, and they just relied on the toxicology. And if we're talking about beyond a reasonable doubt, if you can say, well, someone who's in their 50s or, older and you don't check their internal organs, then you can kind of create some of that reasonable doubt there. So I could kind of understand that. I was relieved that we got justice for Chelsea Dockery. You see and feel how these people who have passed away, how it has affected their families in just so many different ways, and how it affects the people, their family members who are still here that may have introduced them to this doctor, or the guilt that's laid on them. There's a reason why prosecutors fight for justice for victims, and that is precisely it.
Her defense attorney argued that she should be sentenced to probation, saying that she was no longer a danger to society and that she would be a law-abiding citizen. And the judge really looked and said, I understand this is a physician and she has no criminal history, etc., but her behavior was egregious. And he ended up sentencing her to 7 years.
Regan shows no remorse. She says herself that she cried at the deaths of every one of the patients, but makes the interesting statement that she can't keep crying for 7 years. This strange statement just tells me that this is somebody who even now is refusing really to accept what they've done. And it's somebody who still is holding on to this sense of themselves as knowing what is best, what should be done, as their judgment. It takes me right back to the early days of somebody who lived an existence where she was free to do exactly as she wished and never really came across any limitations or restraint, and became part of a very elite world that she was not open to question. Her judgment reigns supreme.
Had she survived, her life would have been different. The opioid world is different now than it was when she was practicing. And it's very, very hard for doctors to practice anywhere near the level that she was. So it would have been very different. Even if she'd gotten out and she tried to practice, she would have faced so many different hurdles. She may not have gotten her medical license back. She would have had trouble getting credentialed by insurance companies. And really, the biggest thing is she would have had trouble getting people to trust her, to let her be their doctor again.
When we run across these cases, it taints the profession because we start seeing doctors in a different kind of way. And that's unfortunate because it's always a very small number of doctors who engage in medical malpractice or who do things like this. But I think it does impact our perception. The flip side of that is, I think, being aware of doctors who either make mistakes or doctors who deliberately harm patients. I think there's been much more of a push for consumers to take responsibility for their medical care and to do their own research and get second opinions and those kinds of things. And I think that's the silver lining, maybe that's come out of some of this.
You know, 20 years ago, it was probably hard for you to know someone who had been touched by the opioid epidemic, who'd been affected. Now, here we are 20 years later with over 1 million individuals succumb to opioid overdose death. A lot of these individuals died because they went to the doctor. She should have been the gatekeeper. She should have been the responsible one. There's something wrong with the world when your outcomes are worse when you go to the doctor. In a case like Dr. Nichols, where it was very obvious that she was way below the standard of care in doing dangerous and harmful prescribing, she's got a lot of responsibility. But that doesn't take away the responsibility from the opioid manufacturers who not only allowed but also encouraged such careless prescribing of opioids. And had it not been for the manufacturers and their aggressive unbranded marketing campaign, then Dr. Nichols may not have ever happened.
I think that what allowed her to progress into becoming somebody who could be so dangerous wasn't greed, wasn't money. It was actually an absolute sense of pride. It was a complete refusal to accept that she was making mistakes. It was a complete refusal to understand that her judgment, her way of thinking, her way of operating was not appropriate. She was somebody who had been brought up in an unquestioning, limitless way, without boundaries, without much monitoring, part of a big family. And when faced with this dilemma as a lone physician, she believed she knew better. So ultimately, it was her refusal to admit to her mistakes, gradually, over time, this enormous sense of stubborn pride that turned this wholesome all-American girl into a murderer.